Good morning and welcome back to another video. My badge is, don't mind, I threw it in the back seat. There was a spider in my car, like inside of my car. And while I was driving, I had cars behind me, cars coming at me. So I was really trying to hold it together. I used my badge as like a shield and then threw it. I think the spider was on it when I threw it. I don't know. The whole thing was like kind of traumatic. But I am at work now. I'm working a weird shift today. We really needed some help like filling in some areas throughout the week. So I picked up some extra shifts because childcare is so much easier for me right now, being that my husband's home for the summer because he's a teacher. So I picked up a 1 to 6 today. So I never work this type of shift. It's really short and it's kind of like smack dab in the middle of the day. But it is what it is, and it is really short. Like I said, it's only 5 hours, so I don't feel like it's that bad, and some extra money and all this stuff. So yeah, but it does seem to be one of the busier chunks of the day. So I'm interested to see what I'm walking into as far as like patients in the waiting room, all that fun stuff. We will see though. Hopefully people are at home enjoying this beautiful day because it is so beautiful out, and hopefully that will start keeping more people at home now that it's so pretty out. Although, as of yet, that hasn't happened, but I'm holding on to the idea that maybe today will be different. Every day, today could be different. Today might not be so super busy. So yeah, I'm going to take you guys along, and we'll see what we see for the day. You know, I never know what's going to come in through the urgent care doors. That is the beauty and the beast of it. That's definitely one of the big reasons why I like working in this type of setting. It's like hard for me to formulate that sentence, but same reason I liked emergency medicine, same reason I like working in the urgent care. I just like a wide variety of stuff, and kind of like you never know what to expect. Keeps you on your toes, but definitely gets redundant. It gets redundant in the urgent care. It gets redundant in the ER. You know, you get some exciting stuff, but most of it is redundant, and that's just the reality of medicine these days. But anyway, so let's go to work and see what we learned today. Alright, so as you know, I often begin my shift with reviewing patients' labs and test results. Each report that we get includes the patient's name and date of birth, the study or test that was completed, and then the results or interpretations. So I've actually gotten in the habit of just quickly reviewing the patient report and writing on them the patient's contact number and that the treatment that was done in the office. And this just gives me a way to move more quickly through them if I get busy with patients, obviously, that are in the office at that time. Or it helps the provider coming in after me if they're going to make callbacks as well. It just makes it a lot easier that they can pull out the results and the patient's number and what their treatment was is right there on the sheet. Like I said before, we do try and call back everyone to reassess how they're doing. But the patients that take priority are, of course, those with abnormal test results and anyone that requires additional treatment based on the findings. So this particular day, I had a lot of orthopedic injuries. I spent a lot of time, I felt like, reviewing x-rays, but I can't lie, I really enjoyed that. Much of what I saw was actually negative for fracture, but I did have an elderly woman who had suffered a distal radius fracture from a Fouche injury, and this patient, on exam, they had like obvious swelling and deformity. However, of course, their skin sensation and neurovascular status were intact. If that was of question, then they would have gone to the hospital. But there was a distal radius fracture that was discovered, and so this patient was actually placed in a sugar tongue splint, and they were provided an orthopedic referral for a very close follow-up. And then here you can see inside the cabinet where we have our reference that we use, and we chose, like I said, the sugar tongue splint. Another complaint I saw multiple times in this shift was symptoms of a urinary tract infection. So this patient in particular, she was a middle-aged woman with dysuria, polyuria, and urgency, but she also had a low-grade fever of 100 degrees, body aches, and fatigue. She also had a history of urinary tract infections, her last infection being 3 months prior to her visit today. So her UA in the office showed these results here for you guys, indicating obviously an infection. But of course I was also concerned for pyelonephritis based on her clinical exam, and so I put this patient on Bactrim, sent out a urine culture, and then recommended a very close follow-up with her primary care. Alright, so as you can see, I'm no longer in the office. I completely forgot to close this video out, but it's okay because I actually wanted to hop on here anyway for a moment and just talk to you guys about something else. If you saw my last video, then you do know that I have partnered with Archer Review, and they already have an established NCLEX review if you are familiar with them that way. Now they are branching out and starting a family nurse practitioner boards review, and I am so excited that I get to be starting this process with them and helping to develop all of the content. If you saw previously, I did a free webinar all about the endocrine system. I did that as a 1-hour webinar, and it was free to attend live. And then after that, if you wanted to purchase it, you could for a one-time fee of $10, and that would give you access to it for 30 days. But the live webinar was free. And so I'm doing something very similar, except for this time it's going to be a 3-hour crash course all about pharmacology. The live webinar is going to be free for you guys. So I think it is so exciting that there is an option for you to do this for free. And so what you have to do is July 16th at 4 p.m. Eastern Standard Time. So because I live in Michigan, that's my time. I will be on live presenting about a 3-hour approximate total pharmacology crash course, completely geared towards everything you need to know for your family nurse practitioner boards exam. But no doubt, it will be helpful to anyone that's just starting out in practice or anyone that's established and just wants a refresher, because obviously everything is current. Everything is the most up-to-date evidence-based practice that is presented in this. So if you want a refresher, I do not doubt that it would be a great refresher as well. As always, just reviewing this myself, I continue to learn and I benefit from it as well. So July 16th at 4 p.m. Eastern Standard Time, there will be a free live webinar all about pharmacology. And the same thing again, if you want to purchase the content that you can, then you can. You will do just a one-time fee of $10, and you'll have access to it for up to 30 days after that. So you can rewatch it obviously as many times as you want to during that time. I'm really excited because I think this is just such a great way. If you've been following me at all on this journey, then you know a huge part of my platform has always been to try and offer education at an affordable cost. I don't come from money, I've told you guys this, and I had to take out a lot of loans and include a lot of debt going to school, and I'm so happy that I even had the opportunities to get financial aid and financial support. But that being said, I've invested already a lot of money, and so when I was kind of hit with these boards reviews that were just so expensive, I myself paid $400 for audio files. I just couldn't believe just the nonstop prices that you got, like the cost that came with going to school and graduating with my master's degree. So I've always been trying to find ways to just offer education at an affordable or a free cost. You know, everything on my YouTube has always been free up until this point, and this still offers an option of being completely free to you guys. If you want to just attend the live webinar, take notes, then that is completely up to you, and it is completely free. But if you do want to purchase it and rewatch it, then it's only $10, which I still think is a great deal. At the end of the day, you can't beat it. And so yeah, so I'm really excited to see you guys there. Make sure that you sign up. I will link in the description down below the link to either sign up for that 3-hour pharmacology crash course, or also I will link in there the link to purchase the already recorded Endocrine. Of course, now you can't attend that live. The live is already over, but you still can purchase the Endocrine webinar if you'd like for $10. So let me just kind of show you what we will be discussing when we do the pharmacology crash course. Hold on. All right, so this is the outline of everything that I will discuss in my 3-hour pharmacology crash course. So I will discuss antibiotics, ears, eyes, nose, and throat medications, derm medications, cardiac meds, asthma and COPD, gastrointestinal meds, endocrine medications, hematology, neurology, mental health, and then reproductive health medications as well. So because I did just have that endocrine webinar where we discussed obviously thyroid and diabetes medications pretty in depth, I'll save the endocrine meds for the end of the pharmacology crash course. That way, if you attended the endocrine lecture, you don't have to actually sit through that twice, unless, of course, you want to. I'm still obviously going to incorporate in this because it wouldn't be a total crash course if I didn't include endocrine. That being said, I'm going to save it in the end. So if for some reason you want to leave when it comes to endocrine because you don't want to repeat that, I totally get it. Alright guys, well I think that's going to be all for today's video. Don't forget to like the video and subscribe to the channel. It helps me to continue making content like this. Also, don't forget to sign up for the 3-hour pharmacology crash course that is a free live webinar to you. So make sure you sign up, and then obviously all the other stuff will be down in the description box below that I already talked to you guys about. Other than all of that, I wish you guys nothing but the best. Don't forget to learn something new every day, and I will talk to you very soon. Bye. So hi guys, I'm Brittany Holzbeck. I think probably a lot of you may know me from YouTube or from my Facebook group, but I'm so excited to have you guys here. I wish that I could see you the same way that you can see me, but I think it's really cool regardless that it's in this live platform like this. So thank you so much for joining me. I know that today's discussion, the endocrine system isn't the most exciting, but I chose it because it is so heavily focused on for your boards exam. So I just really wanted to help you guys along in your studying. I'm also going to share with you guys like any quirky tips I've come up with along the way that helped me to remember the material as well when I was studying for my boards exam. So some of them are kind of silly and odd, but I promise you they really helped me with my studying. So I'm going to share them. So in the lecture, my primary focus is going to be thyroid disease and diabetes, because that is definitely the bulk of what you'll see on your boards exam. All right, so let's talk thyroid disease. So as I mentioned, there is the thyroid stimulating hormone, or your TSH, and then you have your active thyroid hormones, so your T3 and your T4. I did provide for you there the normal ranges. We can go ahead and review those. Remember, if you're taking the AANP, they actually do provide you the normal labs. But if you're doing the AANC, then you need to know your normals. So you can just review those for you there. But the best screening test for both hypo and hyper is your TSH. Your best screening test is your thyroid stimulating hormone.